Passive physiological movements for the hips. We're going to start with flexion. Just move a little bit more towards me so I'm not having to lean across the bed. Okay, so we're going to take the leg up, we're going to test the range into full range flexion. Try not to push too much down here across the knee, so try to come around the knee joint, round more onto the femur. Then we're going to come up into full range flexion. You're looking at the opposite side. If you see, as I come into here, the other leg starts to raise up. So that's indicating we're getting to the end of range. If they are particularly stiff, you could always look to try to stabilise and bring that up into flexion. Just as part of your assessment, we're just checking the full range there into flexion. Of course, this may not be, this is a normal range. It may be that they only get to, for instance, here. In which case, if you only get to here and that's your end of range, then that is the point that you're going to work from for your grade 1, your grade 2, 3 or 4, depending on whether it's pain or resistance that you're working into. Once you come to that point, then taking nice control, making sure they feel nice and stable so that they can relax. So for instance, if pain was here, then this would be my grade 1. So small amplitude. Grade 2, obviously, just emphasise coming off. Okay, and 3 and 4, so if I do come into some form of resistance, so here is a grade 3. And then grade 4, or towards the end of range. Okay, move on now to medial lateral rotation. So we're going to show this in a flexed position to start off with. So arm closest, if you are facing your patient, the arm closest to them is the one that comes underneath the shank. Then comes onto the medial side of the knee, holds onto the femur, and then your free hand goes onto the lateral side of the knee. You then try and grip around the knee to affect your rotation. So I'm going to start off with a medial rotation, so therefore the foot's going to come outwards. Then we're going to rotate that into medial rotation here. So I'm pulling from here rather than pulling from the foot, which should actually go through the knee. Into rotation there. Find our end of range. Come back to any point that we need to in terms of demonstrating our grade. So this would be my grade 1. Grade 2, larger amplitude. Obviously this would be going up to the point of pain. Grade 3. And grade 4. For lateral rotation, depending upon their range, so if we just test this hip here, okay, so it doesn't go particularly far, I could therefore do lateral rotation from this side. But if the leg was to come, say, across to here, then what I'd need to do is actually work on the other side of the bed, so the camera side, to rotate that laterally in here. So again, exactly the same thing, doing, say, our grade 1, just outside of resistance, grade 2, grade 3 into resistance now, and grade 4. For abduction, there are a couple of positions we can do. We can do a flexed abduction, depends upon what function you're trying to restore. So we can flex, so take the foot next to, for instance, the knee, depends upon how much flexion you need. Stabilising across on the opposite side, on the opposite hip. Then we're going to take this leg and knee, therefore down and out. So I'm stabilising, taking this out into abduction, feeling for resistance, and obviously looking for pain. Once I find the end of range that I can, then I'm going to work on my grade. So if we, for instance, showed a grade 1, out of resistance, grade 2, larger amplitude. You saw a little flicker there of muscle contraction. That was perhaps speed related. I was going slightly too fast. So they feel like their leg is falling and they'll contract to try and stabilise it. Grade 3 into resistance. And then grade 4 also into resistance, small amplitude towards the end of range. And we can also do abduction in more of an extended position. Just going to raise this bed up slightly. So this time we're going to come underneath, again, facing towards, arm patient side comes underneath and supports on the medial side of the knee. Opposite arm holds on to ASIS to stabilise the pelvis. And then what we're going to do is we're going to take the leg out towards us. Because there will be a natural tendency for it to fall into lateral rotation, we want to therefore medially rotate, which we can then lock with that arm into medial rotation. Okay? If you find that this side starts to shift across, then you can just pop that foot on the other side of the bed so that it's almost gripping against there without them having to contract. Okay, so we can just come out, finding our end of range, and we can do our grade accordingly. Grade 1, grade 2, grade 3 through resistance now, and grade 4. Passive physiological movement for extension now. So again, we're going to come underneath and support, so we can support the lower half of the leg and also just above the knee and above the patella. We're also going to need to stabilise the lower back. Okay, so we're stabilising down into the pelvis. So we're essentially on the sacrum. Obviously you need to get consent, etc. before you do that. You're then going to fix the sacrum here before then lifting the thigh up. If there's lots of twisting and rolling over, you're not stabilising them enough. So it's a firm grip and raise up, and then you'll feel that resistance start to build. It can be quite hard work depending upon the weight of the leg. Okay, so if we have, say, grade 1 here, grade 2, grade 3 into resistance now, grade 4. For rotation, we also have another option in a prone position, just because now we have the hip in an extended position, so functionally, if they need rotation in the extended position, then we can do it here. So therefore we can rotate for our lateral rotation, for our medial rotation. Okay, so exactly the same thing, just in a different position. So of course we can test our range. Form our grades. So for instance, grade 1, grade 2, grade 3, and grade 4. Work on the other side in terms of the opposite rotation. Same thing, just stabilising, bringing it across. Some people will have a lot of range here and then you're knocking to the other leg, in which case you can no longer do any further rotation in this position. Testing the range, grade 1, grade 2, grade 3,